Now, the Nigerian Customs Service is preparing to establish a dedicated corridor aligned with the initiative from the World Customs Organization and the World Trade Organization aimed at addressing challenges within Nigeria's healthcare system. During a dialogue session held in Lagos on Friday between the Nigeria Customs Service and the Healthcare Federation of Nigeria, Comptroller General Bashir Adeniyi assured the HFN of the customs commitment to easing the bottlenecks in cargo clearance. Dr. Pamela Ajayi, president of the HFN, welcomed this initiative, highlighting its potential to make medical treatments more affordable and accessible for Nigerians.
As much as possible to increase compliance. We have programs, we have sensitization programs that we teach our freight forwarders as well as importers on what they need to do. We have what we call the advanced ruling program, which I talked about earlier, which allows you to write to customs and apply what is the classification, what is the value, what is the origin of this goods I want to import. They will now give you a written document that is binding, so that will help you to now know even beforehand. So that increases compliance and helps to plan while you are doing that on legally binding documents. So that will even help our importers and our freight forwarders to be compliant, to help them. We only arrest smugglers at the borders, but for importation to the ports, we do as much as possible to sensitize our stakeholders to be compliant.
Since everybody was here and they were talking about their issues, coming together as a body, a healthcare body under the Healthcare Federation of Nigeria, to push the issues and to make sure that we address the problems that our healthcare system have. And we were able to do that. He has promised to set up the special corridor that was initiated by the World Customs Organization and the World Trade Organization on the back of COVID. They insisted that this special corridor be set up to expedite the clearance of healthcare cargo so that people don't suffer the way they suffered during COVID. And so this is what this corridor is about, to make sure that people don't suffer.
We would work with the Healthcare Federation of Nigeria to ensure that the healthcare system, to a lot of extent, is improved by ensuring that goods that are not readily available, that would take care of the citizens, their health, is imported expeditiously into the country. And of course, those items that we have competitive and comparative advantage to produce locally, we would also wish to protect them from coming into the country, because the influx of those items would have, whether they're medical equipment or drugs, if we have capacity to produce them, we will not allow the influx of such items into the country.